A very warm good morning. I'm Dr. Najva Sherin, final year postgraduate from Madurai Medical College, Tamil Nadu. Our study is an optic nerve head and retinal nerve fiber layer analysis in patients with alcoholic liver disease. Alcohol is the world's third largest risk factor for disease burden, and it accounts for 3.5 million deaths worldwide every year. Most of the mortality attributed to alcohol is secondary to cirrhosis, that is 50% is due to alcoholic cirrhosis. Significance of the study: understanding alcoholic liver disease retinal impact can aid in early detection and prevention of blindness and thereby ensure an improved patient care. Our primary objective was to investigate changes in optic nerve head parameters and retinal nerve fiber layer thickness in patients with alcoholic liver disease. And our secondary objective was to correlate these changes with liver disease severity score, that is the Child-Turcotte Puig score. And our study was an observational study. Study group: cases were formed by 70 alcoholic liver disease patients admitted to the general medicine ward of Government Rajaji Hospital, Madurai. And controls were 70 age-matched individuals without alcoholic liver disease from the ophthalmology OPD of GRH Madurai. Study center, Department of Ophthalmology, GRH Madurai. Inclusion criteria: age more than 18 years and alcohol consumption of more than 50 grams per day for 5 years, and aspartate aminotransferase by alanine aminotransferase ratio of more than 2, and USG abdomen suggestive of fatty liver or coarse echo texture of liver were included as the cases. Exclusion criteria include age less than 18 years, refractive error of less than 6, more than 6, pre-existing ocular pathology, patients with any other form of liver disease, substance abuse other than alcohol. Methodology: all participants underwent a comprehensive ocular evaluation and OCT examination using Topcon 3D OCT 1 Maestro 2. Statistical analysis was done using Excel and Python, and a p-value less than 0.05 was considered statistically significant. And these were the key findings. Mean RNFL thickness and RNFL thickness in all quadrants were reduced in cases when compared to the controls. And this is the graphical representation showing mean RNFL thickness and RNFL thickness in superior, nasal, inferior, and temporal quadrants were lesser in cases when compared to the controls. And in optic nerve head, the average rim area was lesser in cases when compared to the control. Average linear cup disc ratio, vertical cup disc ratio, and cup volume were greater in cases when compared to the control, and all these values were statistically significant. And this is the graphical representation showing a reduced rim area and an elevated linear cup disc ratio, vertical cup disc ratio, and cup volume in cases when compared to the controls. This is statistically significant thinning of RNFL in all quadrants and an increased cup disc ratio, cup volume, and reduced rim area in cases when compared to the control, but this did not correlate with Child-Turcotte Puig score. OCT can thus serve as a critical tool for detecting and monitoring alcoholic liver disease-related ocular damage. There's a need for interdisciplinary care between hepatologists and ophthalmologists is essential for the comprehensive management of alcoholic liver disease. RNFL thinning in alcoholic liver disease is consistent with findings by Alvarez-Cismero et al. In chronic alcoholics and Ahuja et al. In alcohol use disorder. RNFL and optic nerve head changes did not correlate with Child-Turcotte Puig score. These align with the findings from study by Agdamir et al. Among patients with cirrhosis. Future direction: expanded cohort involving a large multi-center studies are needed to enhance the generalizability of the finding, and longitudinal studies are needed to assess the reversibility of RNFL and optic nerve head changes post-alcohol cessation or liver transplantation. We can also assess the role of therapeutic interventions like antioxidants and vitamin supplementation in preventing ocular damage. These are my references. Thank you.
Nice study. Thank you so much. Any comments?
I just wanted to ask if you would like to add any kind of neuroprotection in such cases if you identify optic nerve damage or retinal nerve fiber layer thinning.
Ma'am?
Would you like to add any neuroprotection to such patients if you identify?
Yes, ma'am, but this study was an observational study. So here we assessed the alcohol liver disease severity and how much damage was there in the retinal nerve fiber layer and optic nerve head. In future, it can be considered.
Because we have to settle down to the clinical relevance of a study if we are doing it.
Yes, ma'am.
So if there is anything as such which we have identified, then that would be, of course, the question, if how we are going to intervene.
Yes, ma'am. We have considered as in the future directions.
Yes. Okay, thank you.
Thank you.
Was there any change in macular thickness? Have you studied that?
In this study only the
Opening arm
arnold thickness is
Macular you
considered.
did not study.